Jessica Dufault, Mindful Motion Physical Therapy, Women's Pelvic Health and Orthopedic Physical Therapist. I decided to do this video today as a way to give you guys a visual of some of the points I had made in one of my recent blog posts. And this blog post was in response to the new mummy tummy exercise method that has been on the internet and TV lately. So I got this idea for balloon model a couple years ago from a fellow women's health physical therapist, Julie Wiebe, and it's a really great way to kind of demonstrate exactly what happens in the core. And so just like our core, this balloon is a very pressurized system, and at the top of the system is the diaphragm, in the center are the abs, and of course along the bottom is the pelvic floor. And so this pressurized system is what holds all of our abdominal contents and specifically our pelvic organs. So one of the comments I had made in response to the mummy tummy exercise was my caution with the idea of over gripping and squeezing the abs tighter, 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 tighter. And so, yes, when we have diastasis or we have a split down the center of the abs, we may in fact be bringing the two pieces together in the middle, but then to what extent? So you can see that the pressure is just forced elsewhere. And so we're not really correcting the problem, we're just positioning it at a different spot, particularly the pelvic floor. And so one thing to understand about the core system is that when we breathe in, so we take an inhale and breathe down with our diaphragm, the pelvic floor needs to yield to that as the abdominal contents push down. As we exhale, we get a really nice recoil of the pelvic floor and the diaphragm. And so one of the things to consider when doing exercise is that we should in fact be cueing pelvic floor activation up just prior to abdominals in order to limit that down pressure on the pelvic floor. And so this is really important for the postpartum body because yes, mummy tummy exercises may in fact close diastasis, and you may lose a couple inches off your waist, but I feel like it's doing a disservice to the really complex postpartum concerns that might be present other than just diastasis and a little bit of extra belly fat. So this advice is actually really good though for anybody who has a core. So young, old, male, female, doesn't matter. The way we train this, or in fact retrain this, is by making sure we have a coordinated effort between all three really important pieces of this system. Thank you.